Hello folks, this is Mike Openshaw. I was asked by some people online that if I would consider doing some video on COVID-19 from my experience and tracking of this since January 23rd. I've been kind of aware of it. For those of you who don't know me very well, my background is this. My first career was in medical microbiology and virology. I started working in medical labs when I was 17 years old. My first degree was in microbiology, bachelor's degree. I went to postgraduate studies. I worked in virology labs for a couple of years doing research. I'm an all but dissertation with microbiology and virology. My major professor got fired from the university and he was the only virologist, and they told me I'd have to start my work over. So I didn't have the money to continue, so I'm classified as an ABD, all but dissertation in biology. And I practiced that in medical labs and academic labs and industrial labs for about 18 years total, 11 years in medical and academic. Then I got a second career in database, master's in information systems. I've been a data analyst for the last 10-15 years, so that's my background, and it kind of fit when this disease came around. I also have a lot of connections in the Asian community. My wife is from Taiwan. I have connections in the African community, so I have kind of a global presence in terms of family. So I was early on to be concerned about this, and back in January 23rd I started posting about how serious this thing is in China, and if it ever got over here it would become serious, and it did. So I'm not going to go through the whole history of it, but I'll start by saying, where do we stand now? Well, fortunately it looks like a couple of things that we're hoping for have come true. We're suffering what is called something that resembles a summer burnout, that we're getting a lot less cases. People are outdoors more, the sun, the UV radiation, all that stuff plays a factor, and enveloped respiratory viruses tend to not do well outside the confines of an indoor moist environment. So we're getting quite a bit of reduction there. It's been a disaster in terms of the number of cases globally and in the United States. It is what it is. It is a very serious infection. It is not the flu. It has more long-term consequences. It does have a higher death rate. You can try to pretend it is not a higher death rate by coming up and extrapolating cases that were asymptomatic, that we don't know what the actual counts are of that. The most insidious thing about this are the asymptomatic carriers who are infectious. They're not as infectious as the symptomatic carriers, of course, but they are infectious, and that has caused the greatest amount of spread of this disease. Its long incubation period of generally 10 to 14 days has presented an issue. A lack of understanding of it has presented a lot of issue. The novel nature of this virus and how it attacks apparently the red blood cells, releasing the iron from the hemoglobin, causing a lot of problems in the lungs and the rest of the body. It also causes blood clotting problems, so that's made the numbers kind of gray. If somebody has COVID-19, they suffer a heart attack. Well, heart attacks are caused by blood clots in the heart, in the cardiac arteries and veins. Did COVID cause the heart attack, or did they just have a heart attack because they had a normal blood clot? So how do you, even an autopsy may not tell you if COVID killed that person. But COVID probably added to the chances of that person dying tremendously. So how do you count them? So the numbers are kind of vague, but the basic situation is the numbers are falling in the United States and globally. Things are getting better. the danger, of course, is a second wave in the fall when we have to go back inside, when things get cold again, and the like. But the good news is it seems to be that the virus is losing some lethality. Now that seems a little strange, but that is probably the normal course of most viruses that make a transition out of an animal vector to human. The reason is very simple. It's not any brains on the part of a virus. It's simple natural selection. A virus that kills you or just totally disables you is not spreading it to other hosts and is not replicating nearly as much as it would replicate if it can spread to 15 other hosts. So as mutations occur, those that are more mild will tend to survive longer than the ones that are severe. And there's no question this virus, this SARS-CoV-2, CoV-2, is a single-strand RNA viruses enveloped, and it is suffering quite a bit of mutation. There are at least 2 big variants, one in Europe and one in Asia. There are a lot of subordinate variants, but so the lethality may be dropping. It's still a very, very serious situation for older people, people who are not in shape, people who have pre-existing conditions. But asthma should not be a reason to excuse a lethality, okay? So quit saying, oh, well, they had a pre-existing condition. He would have died anyway. No, not necessarily. So the big thing is, what can we do about it if we do get a fall? Right now, the concern, besides recovering the economy, is what can we do about it from what we've learned so far? Well, one of the things we definitively have learned is full lockdowns without other mitigating situations do not work. This is to our government officials. Don't screw up the economy this badly ever again for this one. Okay? There are mitigating things we can do and keep the economy running. There are narrow focus lockdowns that may prove to be necessary. We do not know in the future, but they need to be very narrowly focused to those things that generate what is called a super spreader condition. And that is not every business in the planet. Don't do this again. The lessons we can learn is how many countries addressed it. America followed Europe's example, and before we ever did, I was watching Italy saying, do not do this full lockdown. It doesn't work. Okay? The lessons of countries that did succeed are the ones we have to learn. And where it did succeed was primarily in Asia. And how they did it was controlling specific populations. Yes, they violated some rights of some people. Okay? That happens. Taiwan is probably the primary example. My wife is from Taiwan. She watches Taiwan news. I have watched their reporting of it and how they are handling it, and their numbers are ridiculously low for somebody who was so in the center of what was going on there. How did they do this? Number one, enforced isolation of actual cases. You had to be quarantined for 2 weeks. No ifs, ands, or buts. Sorry, you have rights. The citizens around you have rights to not to die from whatever the hell you're carrying. Okay? Sorry that a disease would cause you to do that, but this is a 2-week isolation, or until you're well isolation. They also did 2-week quarantines of international travelers. My niece and nephew went to Taiwan, had to be in isolation for 2 weeks. If they left the house out of isolation, they were subject to a $10,000 to $300,000 fine if they were caught outside. They did not mess around in Taiwan with this. Sorry, yes, you're isolated for 2 weeks in a home environment and you cannot really get out of there. Okay? This is a violation of those people's rights. But would you prefer that or 30 million people thrown out of work and not able to work? Okay? The virus is not giving us much choice in this. Okay? It hasn't up to now. So, and the other thing, I'm sorry, you can argue all day long you want to, but masks do reduce infection rates. The goal here is to drop the R0 or R null value to below 1. That's the rate at which one person who's infected infects other people. If it drops below 1, if one case generates less than one other case, the number of infections start to fall. Masks help that by restraining droplet transmission. Don't tell me about the diameter of viruses. That's stupid. That means you don't understand that an envelope virus, respiratory virus, normally transmit by mass in vast volumes by droplet transmission. I am talking right now, I am putting droplets out here. If you were at my camera and I was an asymptomatic case of COVID and you didn't have a mask and I didn't have a mask, congratulations, you probably now have COVID-19. Okay? If I have a mask, because I'm speaking into the mask, my droplet transmission would drop drastically. 100%? No. But this is not a game of absolute. This is a game of percentages and the like. If you're wearing a mask, it will stop the droplets from being inhaled as readily from you. It may end up on the outside of the mask. It may actually get into your eye. Eye transmission does occur. That is why the person who has an asymptomatic case or has a symptomatic case being masked is much more important than a person who doesn't. I don't know if I'm asymptomatic or not. Do you? Do you have any proof that you're not asymptomatic? Do you think you're just better than everybody else? You can't possibly have it? Yeah, okay. Go ahead and go with that. All right? I'm a believer in the freedom to mask or not mask, but I'm an advocate that people mask in indoor, close contact environments. Outdoors, walking, outside bicycling, don't bother. Come on, think about this, folks. So this is what my recommendations have been up to this point. We're getting at a point that counts are getting low enough that it's becoming less important, but it's still worth doing. When you go in the store, put a mask on. By the way, another aspect that they're finding out about this virus is that fomite transmission, which is contact. When you cough on a surface, you touch it, and then you do that to your mouth. Oh, gee, I just did that. Is at a pretty low rate on this particular virus. It doesn't seem to do very much transfer in this manner. So this is good news if this is the case. That's not to say hand washing, hand sanitizing, all this stuff is not important. Okay, it is. Okay, and so we continue to do that. That's good in any case. Okay, that's good in any case. The masking right now is good for cutting down flu even. Okay, it doesn't kill you to wear a mask when you go into Walmart or you go into the food store or go into the store. Put the mask on, learn how to put it on and take it off properly, and then dispose of the the disposable ones. Use those. If you have a cloth one, sanitize, disinfect, and iron with the hottest iron, and just sanitize the heck out of it on a regular, very regular basis. But understand that outside surface may have some virus. Okay, something you need to be concerned about, and so when you take your mask off, wash your hands. Simple. It's a simple process that I'm recommending that we continue for a little bit longer, but not much longer, and mainly indoors, high contact. These are things we can do. These are simple things we can do. It doesn't take away all your liberties, please, folks. Okay? It's an inconvenience. For some people, they can't. That's fine. 80% masking. 80% masking will drop the infection rate low enough, and this thing will start to disappear very rapidly. 100% would be best, of course. Some countries do mandate it. And I'm not a big fan of mandating. I'm a fan of encouraging in this particular case, particularly for governments. Business has a right to mandate health and safety requirements in its business. Accept that. If you don't like that, go to another business that doesn't do that. So this is where I stand on all that stuff. This is my recommendations from all my reading, and believe me, I've been reading all the scientific papers back and forth, and masking and not masking and this and that. But the final analysis is this: those countries that did universal masking have massively lower rates of deaths per capita, have massively lower cases per capita than countries who did not. That is even in Europe, where the Czech Republic took on the unique aspect of doing no lockdown but using masks, and they have a very, very low rate. I've been told any number of times about Sweden. Oh, Sweden is going for herd immunity. Well, they just admitted that they failed. They're only at about 7% even in Stockholm from antibody testing. All right, that didn't work for them. No lockdown, go for herd immunity. They have a pretty darn high death rate per capita, and their infection rate's not high enough to be herd immunity. Full lockdown didn't work anywhere in Europe. We've seen Italy, we've seen Belgium. They're just flaming disasters because they left travel untouched, essentially. They let everybody travel, from this country to that country everywhere. So it just spread like wildfire. Leaving mass transit running is insanity. Okay? Sorry. That's New York City. The subway slaughtered tens of thousands of people, putting the nursing home patients back in the nursing homes before they were absolutely negative of COVID, slaughtered tens of thousands. Those 6 governors in those 6 states in the Northeast all are culpable in the death of all of those nursing home patients. Okay? Just fess up, dudes. Anyway, so that's where we stand on that. Hopefully things are fading off. We need to get back to work. We need to get back to work smartly, using methods that are not that insidious to continue to prevent droplet transmission in closed-in indoor environments. Other aspects that are going on in terms of government reaction and everything else are just kind of silly. Where they were chasing people down on the beach. What is wrong with these guys? Okay. We're about to get some testing that we hadn't planned on with these protests and riots of masses of people outdoors. We all pray that this doesn't cause a major spike in cases, but we're starting to see that there may be some spike, hopefully not much. Outdoor activity, UV radiation, the circulation of the air, everything looks good. There were studies that out of 318 cases of spread in China early on, of 318, 317 of them were derived from indoor activities. Only 1 was outdoors, and it only affected 2 people in an outdoor cafe. So indoor activity looks good. Lots of controversy about hydrochloroquine. It's a generic. They keep trying to say how terrible the side effects are. They're not. I've taken it myself for anti-malarial several times going to Uganda. I plan to do it again in this fall when I'm going to go. I was supposed to go in the spring. I will not. I will be taking it. The package of hydroxychloroquine, Z-Pak, and zinc seems to be of some benefit. There's been shenanigans going on about making it look bad. Some of that is anti-Trump activity. In a lot of ways, I don't like Trump either, but not to a point where I'm going to change my medical assessments of stuff based on whether he likes it or not. The studies that have been put out there were from a very suspicious data source. There is a lot of money on the line here for vaccine manufacture and for use of far more expensive antiviral drugs for the treatment of this disease. So I'm not a conspiracy theorist, but you know, this all looks, the Lancet article and JAMA look like they really may have stepped into this by being conned with with deliberately bad data. So hopefully with the HCQ protocol, with the zinc and Z-Pak, we will get enough reduction. It's not a miracle cure, but it will reduce it enough to where it's far less a problem. We did find out that ventilators was pretty bad idea overall. Very few people who went on a ventilator actually survived this. Hopefully they learned a lot more about how to administer the very severe cases better than they did at the beginning of this, because it was almost guaranteed death sentence to go on a ventilator initially. But we've learned a lot. It's a novel virus. It's totally screwed up our economy. Not so much of the virus, but because we decided to go the stupid route that the Europeans did and didn't follow the Asian examples, because we just didn't feel comfortable doing some of the things the Asians did. I feel a lot less comfortable about destroying our economy. I think you do too. So we need to keep this in mind for the fall if we need it again. We also need to keep in mind who did a really bad job in handling this stuff. And I've posted any amount of records out there showing that your chances of dying from this disease per capita were 4 times greater if you had a Democrat as governor than as a Republican. Remember, the governors were setting policies in these states. There are a lot of reasons for that. There's density issues and stuff like that, but hey, you have to factor in all factors of why this population had massive problems in the Northeast, and we had very much lesser problems elsewhere in the country. So factor all that in, folks, particularly come November. I'm not going to sit there and slam Fauci or Bix or whatever at all. They're epidemiologists. They have very narrow focus. They're getting information this way, that way, and this way. They're in full information overload. They're suffering. It's giving them bipolar disorder at this point. I don't pay that much attention to them anymore. The CDC totally screwed this country with its incompetence that was at the lower levels, not from the very, very, very top, but down the chain in terms of handling testing and recommendations, in sucking up to the World Health Organization, who was in the pocket of the Chinese. You know, this is just an example of the federal government not being competent at something. So it is what it is. Oh, look at this. Hand-to-face protocol violation. I'm in my home, folks. All right. In fact, I've been suffering a lot of hand-to-face protocol violations, most of them like this. Anyway, so I cut this tape. I'll see if I can put it out there. It's a starting point. If I put it out there and anybody feels it's useful, have some comments, feel free to comment. And we'll go from there. And you guys have a good day, and stay safe. All right, talk to you later. Bye.